Hello friends, happy Monday. Welcome to another episode of Learn with Flo. If you are new here, welcome. If you're a repeat watcher, thank you so much for being here. I'm super pumped to be back with you guys here. We're going to be diving into more fun topics here around the world of functional dermatology today, right? So it's been a minute since I've really dove into some skin issues and skin conversations, and feel like it's been coming up more and more in my private practice, and even with some consults that I've been having with individuals as well too, because I think in the world of conventional and functional medicine strategies, everybody's always kind of looking for a full picture, right? Not just a Band-Aid solution, but really kind of looking to ask the question of like, well, why? Like, why am I struggling with these issues? And I think the skin is one way in which the body really tries to communicate with us from an inside out approach. And so I think there's a ton that we can learn from it if we're willing to kind of pause and listen, right? So again, if you're anyone like myself, it's likely that you yourself, or maybe at least someone you know, has experienced firsthand some serious skin issues, whether that's things like acne, psoriasis, eczema, dry scaly skin, rashes, right? And all of these things are one of the first places we want to go to is like straight to our specialists that love to talk about skin, which is our awesome dermatologists, right? And so they're going to help us really suss out like, ooh, what are we dealing with? What's going on the skin? But the tough part is they're not necessarily always equipped with that inside out look, right? They come in with some great topical solutions for us, which we absolutely need. Thank bless for some of those topical solutions, especially in times where we need it. But a lot of times they just end up kind of being this cyclical door, right? Of like, oh, come back when you need more, right? Or just apply as often as you want to. And it's like, yeah, but why does it keep getting worse? Or why is it not getting better, right? And so that's where I want to kind of offer a different approach when we start to understand that the skin is often a reflection of what's going on the inside, right? Especially when we start to think like gut health, microbiome balance, and all of that good stuff as well too. So if you are personally someone that has been affected by these, or maybe you know somebody who has been, or someone in your life that has struggled, please, by all means, send this to them. Because, here we're always talking about how the body is like looking at as a whole, right? We're not here just to, look at something like skin issues, right? And just put some sort of topical Band-Aid on it. We're going to be bold here. We're going to be a little different here. And we're going to ask like, well, yeah, sure, the body's communicating to us in that way, but like, well, why? Like, what is the source, right? That's obviously a very inflammatory reaction that's coming out of the body through the skin. And so what's the source of that inflammation? Maybe we should go after that and identify that source of inflammation and like, go after that, right, as our inside out approach. So feel free, like I said, to send this to family members and friends as we kind of start to dig in a little bit, especially if there's some key pearls in here that really start to get your wheels turning, right? So in the world of, like I said, whether it's functional dermatology or even just like functional medicine as a whole, we want to kind of zoom out and understand that like every system in the body, even the skin is a system, right, of the body. And so every system, every cell of the body is in constant communication with each other, right? And what you guys have kind of learned probably through a lot of these Learn with Flo episodes, that the body crosstalks to each other, and we call these crosstalk axis, right? So different axis in the body. So like the brain adrenal axis talks to each other. The adrenal gut axis talks to each other. The gut talks to the thyroid talks to the ovaries, right? So we know that all of these systems, they're always cross-talking with each other. And it's like, what's going on in your world? Here's what's going on in mine. How do we want to make sure that we're communicating this to the entire body? So really, when we start to think about like all of these gut connections, we know that in a weird sense, right, as you've probably picked up on, a lot of times where the symptoms are manifesting is not always likely the source of the issue, right? And this is where, like I said, a lot of times we get this missing gap in the world of like conventional medicine, because we start to treat exactly where the source is that's communicating with us, right? So it's, in this case, like talking about from a dermatological perspective or a skin perspective, it's like, oh, she's presenting with skin issues, I'm treating the skin. And it's like, wait a second though, all of the systems are talking to each other. So like, why is the skin doing what it's doing, right? It's doing it for a reason. It's not dumb. The body doesn't make mistakes, right? The body is always doing something for a reason. We just have to figure out what that reason is. So when I say that where the symptoms are manifesting is likely not always the source of the issue, sometimes really throws people for a loop, but then they start to recognize, they're like, oh, so that's why like all of these Band-Aid strategies exist, because we're not looking at how the body is communicating and cross-talking to each other. So we're constantly just chasing the symptom with a different Band-Aid versus like really looking at it from an overall crosstalk perspective. Yeah. And I think that that is very true, especially when it comes to the skin. So very, very rarely is the skin itself actually dysfunctional, right? In terms of acne or psoriasis or eczema or dry scaly skin, right? It's like that is the body communicating something from the inside that's out of balance, and the skin is exposing that weakness or that dysfunction of the body. So very, very often when we look at skin issues, we're absolutely going to be talking about the gut skin axis, right? So when I talk gut skin axis, it's like, oh, so you're telling me that this is our body's way of telling us what is going on in the gut by communicating through the skin. But it's not really a skin issue. It's our body trying to tell us what the heck is going on in the gut and give us a little glimpse. It's like, hey, I know you can't see in here of what's going on in here. So here's a little glimpse into your external world of what's going on in here. So if we're seeing acne and redness, or even like flushing or dandruff or dry patches, or even like more devastating and impactful conditions like acne, hives, eczema, psoriasis, fungal infections, right? Like even like toenail funguses and things like that. It's like often like these things aren't really taken seriously, but skin conditions can greatly impact someone's like self-confidence, their quality of life, their mental well-being, right? So it's like, this is something that we really want to make sure we're taking a comprehensive look at. Like I've seen a lot of, not just females, but even males in my practice that come to me, and depending on what skin issues they're dealing with, they might start to dress differently, right? To cover certain areas, right? It's like they're thinking about it in how they dress themselves and how they pick their clothes, or what they choose to buy or what they choose not to buy, right? A lot of times like individuals might be like rash or breakout on the back of their arms and they refuse to wear a tank top, like even in the dead of summer, right? It's like, oh my gosh, like that's greatly impacting their quality of life and their self-confidence, right? Or maybe they start to decide like different social situations that they attend or don't attend due to like shame and embarrassment over like a flare or a breakout. I've heard that so many times of individuals not putting themselves out there or going to an event because of like the state of their skin. Or maybe they start to develop like even anxiety triggers because of it, right? They're like frantically eliminating foods, trying to figure out what it is. I can't tell you how many people have come to me with chronic skin issues and they're like, I completely changed all of my soaps. I threw away all of my washes. I threw away all my towels. I threw away all my loofahs. I use a new razor every single time that I shave. Like all of these different things that people are just grasping at potential things because all they're looking at is the surface, right? They're looking at like what's going on from an outsider's perspective. And it can cause a lot of anxiety and a lot of overwhelm, right? And so I take skin issues very, very seriously because I know that it's deeper, no pun intended, thinking about the gut skin axis, but I know it's a lot deeper than just the skin issues on the outside, right? I'm like, I know that number one, it's deeper because the body and the gut is likely communicating to us something very important from an inside out perspective. And I know that these skin issues greatly impact someone's quality of life and confidence, which is like number one priority for me as well too. Like that's why I do what I do, is that you go out and like live your highest quality life and highest health potential possible and accomplish like all of your wildest dreams, right? Those are people that like feel fantastic, are the people that are doing that, right? So if we really look at this, we want to kind of take a step back and maybe even ask like, okay, how are the gut and the skin connected? The skin is often the first place that starts to kind of show some of the effects of an unhealthy or an unbalanced gut microbiome, right? So in some ways, this might, like I said, test some of your guys' like imagination a little bit. But ironically, in some ways, your gut and your skin play very, very similar roles in the body, right? So both of those act as barrier systems to defend the body against different pathogens, right? So you think about like the gut in and of itself, it is something that's kept completely separate from the bloodstream until the body determines like what leaves the gut and goes into the bloodstream versus what gets pooped out, right? Or you think about the skin acting as a barrier system of like what gets absorbed, what gets passed into the bloodstream versus what does not get absorbed or passed into the bloodstream. So they tend to play very similar roles in the body. Also, your gut and your skin are also covered in different beneficial bacteria, right? In a healthy state. In fact, your skin contains like 300 to 500 different bacterial species, which is pretty crazy. And like the more diverse, the better. Same thing with the gut, right? So we just see that there's like so much similarities because we also know like the skin is a major detox organ, right? It's always looking to eliminate eliminate substances and eliminate waste that is created during that detoxification process, right? So we know that a lot of times like when these microbiomes, like the skin is a microbiome, the gut is a microbiome, they share so many roles that they're absolutely going to also share a lot of like symptoms and similarities, right? So we know that there's a gut-skin connection. A lot of times though, from a conventional medicine understanding, we go as far as utilizing like topical antibiotics, right? So it's like, ooh, we know enough to be dangerous. And it's like, ooh, I know that the bacterial balance of the skin isn't quite right. Oh, here's some antibiotics to rub on it, right? It's like, ooh, so close, right? It's like, yes, you are not wrong that there is a bacterial imbalance problem here. We can treat it topically, but we also need to go in deeper and ask like, where did that imbalance come from? It came from the gut, right? So we could put topical antibiotics all day long, not probably gonna really move the needle long term, right? Or better yet, here's some oral antibiotics, right? And it's like, this will clear that right up. And it's like, oof, like, so close. We can do that and just kind of come in and like flamethrower the bacteria in the system, but that doesn't necessarily ask us, well, why? 9 times out of 10. I would venture almost even to say 10 times out of 10, but nothing's ever absolute. So we'll say 9 times out of 10. I will see individuals come into my practice with chronic dermatitis issues, with chronic eczema issues, chronic psoriasis, chronic acne issues, and they have been on so many antibiotics in their life. So many, right? And so like either they're going to eventually, if not already, become resistant to antibiotics. You do not want that, not for a skin issue, right? Because it's like, I want you to be able to respond to antibiotics should you need them for a life-threatening situation in the future. Do not use like prophylactic antibiotics just like willy-nilly, right? Or they're just like on this rigmarole of just like constant antibiotics. And I'm like, that's just, nope, red flag. We should not have to be on chronic antibiotics to regulate our skin issues, because that tells us that we're not actually fixing the problem then if it keeps coming back, or you have to continuously take this medication or take this like topical solution in order for it to stay at bay, then we didn't get the root cause problem, right? So all of these things can be part of the treatment plan to help calm some symptoms, but you have to go internal. We have to start understanding that all skin issues, whether it's acne, eczema, psoriasis, dry scaly skin, dandruff, fungal infections, like what's going on in the gut. That is just like an external reflection of the gut. So When I think about like the lowdown method here, how do I treat and handle patients that are presenting with chronic skin issues? And this may not be the only thing that they're dealing with, but maybe it's a big part of one of their major goals. What are some things that I'm doing? What are some things that I'm considering here that may feel very different than a visit to their dermatologist, for an example, right? So, number one, I'm going to identify the source of the inflammation, usually through some testing practices, right? So we're going to take that deep dive look within and start to look for where are the sources of the inflammation. Why is the body starting to push some of this inflammation out into the skin? So usually when it comes to like the skin gut connection, love me a good comprehensive stool test. I think that is very, very helpful because we can assess for digestive function, intestinal inflammation, the microbiome itself, the balance between like good bacteria and pathogenic bacteria. We can look at things like leaky gut or like intestinal permeability. So just as some fun facts, like when I'm doing like a stool test or looking at some things like this with someone, a lot of times it can look like certain patterns, right? It's not always 100% true, but like eczema, for an example, sometimes is the result of like a staph infection or overgrowth. Psoriasis is usually associated with like high levels of like gram-negative bacteria or what we call like lipopolysaccharide producers in the gut. Psoriasis is also connected to something called H. pylori. Go back a few episodes, we talked about H. pylori. Acne, usually very much associated again with H. pylori or even like some downstream like different protozoas or different parasite action. Also other common contributors here would be things like candida infections, yeast infections, mycotoxins, even like SIBO, right? So there's some very particular pictures sometimes that show up as trends or patterns for individuals that have certain skin conditions. Once we kind of see and identify that pattern, cool, now we can work on not only reversing that pattern, but this is the key. This is like where this is the hill that I will die on, and why the lowdown method is always different is we're not going to just come in and talk about like the active inflammation that's going on or like the active infection. We're going to talk about how are we going to make sure this does not come back again. Like that is a key difference. Anybody out there can be like, oh yeah, here's some antibiotics, here's some antimicrobials. That is not a gut health protocol. Like I will shout that from the rooftops. Like if you're doing gut testing and somebody just puts you on supplements, like that is not, no. Hard pass. They have duped you and they have taken your money and run, right? Because that is going to grow back 100%. It's no different than taking an antibiotic and it coming back every 3 months and having to take another antibiotic, right? So don't let anybody in the functional medicine world dupe you into the same shit, different day of just like utilizing like herbal antimicrobial supplements. Like that is not the sauce. Like it is about why and how did this occur in the first place? How do we get rid of it? And also how do we make sure it doesn't happen again? So this is like a 3-phase process, right? And sometimes each of those phases can take a little bit, right? So first we're going to identify the source of the inflammation through testing. Usually through stool testing can be really helpful. If I suspect that there's some like toxins in that picture as well too, there's some additional toxin testing that we can run as well too if we suspect that there's more. Step number two, once we have some of this testing, we start to understand what we're looking at. We're doing like deep nutrition first and foremost. There has to be a food forward method to the madness, right? So definitely leaning into like an anti-inflammatory diet. We have to move people away from like just the standard American diet. So it can be very helpful for these individuals struggling with skin conditions to learn how to eat in a way that manages their blood sugar. Remove a lot of like the high fat, high sugar, kind of more processed foods, really ramp up fiber intake so that not from supplemental fiber, but like whole food fiber for their detox pathways, and just get a nice diversity in there, right? Your polyphenols, your prebiotics, even things like phytoestrogens, like dare I say it, like soy, right? Like unprocessed soy, like edamame, right? It's like those things can be really, really helpful, especially to like remove some of those kind of pathogens from the gut as well too. So number one, we have to adopt like that anti-inflammatory diet. I will help somebody remove any current like food reactions or food sensitivities that they might be happening. Usually my goal is to always be able to reintroduce those, but some people do need to like think about some of the major culprits for skin issues might be like gluten, might be corn, might be dairy. So some of those can be perpetuating some of that inflammation. It just kind of depends on what we find in some of their testing. Everybody's journey is a little bit different. But if you have gut issues and you have not started with this deep nutrition around the gut first, and somebody wants to skip 5 steps ahead and put you on all these supplements and antimicrobials, go to my Master Your Metabolism class first. It is a 6-week self-paced course. It will teach you all of these foundations that I'm talking about right here, like what does it look like to eat an anti-inflammatory diet? What does it look like to balance my blood sugar? What does it look like to eat whole food sources of fiber intake? All of those are covered in that in depth, and I think you would really, really love that. So you can head to the link in my bio, and you'll get directed to Master Your Metabolism Masterclass, and you can start that right up. So don't pass go. Make sure you do the deep nutrition work, because then along with that deep nutrition work, we're definitely going to prepare the body and open up some of those drainage and detox pathways, right? We might need to spend some serious time here just preparing the body before we even work on like any like antimicrobials or anything like that. Most people skip this step. Most people and practitioners skip this step because they want to go to the sexy like antimicrobials. I'm like, you will make the situation worse. 100%. If you're trying to move stuff out and the drainage and detox pathways aren't open, like even if you have skin issues, that tells you right now you have clogged drainage and detox pathways, right? That's how the body works. It wants to pee, poop, and sweat everything out of your body, right? If there are certain pathways that are clogged, like maybe you're chronically constipated, maybe you're not drinking enough water or urinating consistently, the body will find other outlets for these toxins, and the skin is a major one, right? So if you already have skin issues, please do not skip the step of like preparing and opening the body's like drainage and detox pathways. We have to support like liver and what I call like liver biotransformation first and foremost, right? This is going to come into a lot of your manual lymphatic work, right? Maybe it's saunas or detox baths or rebounding, dry brushing. You will definitely need to be pooping every day. Are you drinking enough water? Are we minimizing alcohol, right? Essential components here for sure. And then we're also going to be addressing the emotional component of skin issues, right? Bet not many practitioners are coming in on incorporating that one. But like unprocessed emotions like anger, bitterness, resentment, rage, they can drastically slow drainage and detox pathways and really mess with a lot of the different energetic tone of some of our detox pathways, specifically through the liver and the gallbladder. So fun facts here. Not going to forget that. So you can already see how much goes into before somebody is even ready for or even talking about like an antimicrobial or dysbiosis like kill phase. Some people don't ever need that, right? And they're like, oh my gosh, I've tried those in the past and my body has just like responded negatively. They never worked. Everything just came raging back. And I'm like, that's because you didn't do it in the right order of operations, right? You have to know and understand the body. And this is where working with a practitioner can be really helpful in that process, right? So the very last step might be addressing any dysbiosis or toxin burden, right? This is why dermatologists are so quick to like prescribe antibiotics, because they work temporarily to reduce some of the skin issues at the surface, but in the long run, you're going to be left with a more depleted gut microbiome than you started with, low levels of beneficial bacteria. Now you're probably going to grow those same overgrowths back tenfold. Right? So it's all going to come back, and you have to ask, why was the gut a hospitable environment for these overgrowths in the first place, and really address the entire mind-body-gut connection if you really want to not be in this same cycle of issues for the rest of your life, right? Other considerations, like we can absolutely use some strategic supplementation here. I love using like some fat-soluble vitamins like vitamin A, D, E, and K can be really helpful. Some different topical treatments that can be really therapeutic. Coconut oil, natural antifungal and natural antimicrobial. Even something like a Kindalua is what they call it, and it's a salve, right? So it's a a natural like ointment that you can put on some of the treated areas as well too. So there's lots of things that we can do that don't just decimate the entire body from the inside out, but lots of different things that we can kind of loop in. But you have to, like, if you're dealing with skin stuff and you really want to reverse it, you have to look within. You're going to have to get a deeper look at what's going on inside the gut, because the body is trying to communicate with you what's going on. It's like, here's a look at the state of the state. If you're curious, like if the skin is any indicator of what's going on internally, like things are a little rocky in here, right? So I do truly believe, like I said, that the body is always talking and cross-talking. And so sometimes where the issues show up isn't exactly where the treatment begins or ends, right? So some fun facts for you guys there in the world of, like I said, functional dermatology is really looking at what's going on in the gut. And you'll see that a lot more in a lot of my education and resources too. So hopefully, like I said, these things like that resonate with you. If you're curious at all about working through your gut, I am launching a Renew Your Gut program as part of my products and services offerings. Again, you can go to the link in my Instagram bio and see all of that on my website, and be able to really understand all of my different product offerings and how to get started with me there. So click the link in my bio. That will take you to all the information you would want and more. And I'll be looking forward to seeing you guys next Monday for another episode of Learn with Flo. But I'll make sure that this one's uploaded to YouTube to add to the collection soon. So head over to my YouTube page too to catch all of my past episodes of Learn with Flo. Happy Monday.